Hey everyone, welcome to Scardia.com. This is Dr. Shafaq and we are back today with another lecture. The topic under discussion today is immune-mediated neuropathies. Immune-mediated neuropathies is not a separate entity. Instead, it is one of the several causes of polyneuropathy. Now, what is polyneuropathy? Polyneuropathy is a diffuse, symmetrical disease process involving peripheral or cranial nerves, which often involves the distal segments and sensory symptoms in a glove and stocking pattern that starts affecting the distal parts and progresses proximally, featuring weakness, numbness, and burning pain. It usually begins in the hands and feet and may progress to arms and legs and sometimes to other parts of the body where it may involve autonomic nervous system. They are classified by course, which can be acute or chronic, by function, which can be sensory, mixed, autonomic, or motor, or by pathology, which can be demyelination, axonal degeneration, or both. For example, GBS is an acute, predominantly motor demyelinating neuropathy, which we have discussed previously, and today we are focused on immune-mediated neuropathies, which are chronic and in nature and are caused by autoimmune process. This is where the body's immune system turns against normal cell structures. Autoimmune neuropathies occur when immunologic tolerance to myelin and axonal antigens is lost. It is thought that both humoral and cellular immune-mediated immune responses are responsible for nerve damage and neurological dysfunction. Now, this lecture consists of 4 sections. The first section is about CIDP, also known as chronic inflammatory demyelinating polyneuropathy. Now, CIDP is a syndrome classically characterized by slowly progressive onset and symmetrical sensory motor involvement. In this section, we are going to talk about the clinical manifestations, the subtypes and pathogenesis of CIDP, and we will see how we can diagnose and treat this neuropathy. In the second section, we will talk about multifocal motor neuropathy. MMN is a rare disorder characterized by asymmetric or multifocal weakness of arms and legs without sensory signs or symptoms. We will see what is the criteria for assessment of multifocal motor neuropathy, how we can diagnose and treat this neuropathy. The third section is all about monoclonal gammopathy. Now, monoclonal gammopathies are conditions in which there is accumulation of abnormal proteins or antibodies in the blood. These proteins are formed by a small number of plasma cells in the bone marrow. The most common condition that is linked to monoclonal gammopathy is the MGUS, also known as monoclonal gammopathy of undetermined significance, which is a premalignant condition. In this section, we will talk about the differential diagnosis of monoclonal gammopathy. We will discuss in detail what is monoclonal gammopathy of undetermined significance, and finally, we will see what is multiple myeloma. The last section is all about vasculitic and anti-HU paraneoplastic neuropathy. Vasculitic neuropathies are a diverse group of disorders characterized by acute to subacute onset of painful sensory and motor deficits that result from inflammatory degeneration of the nerve blood vessels and subsequent ischemic injury. On the other hand, anti-HU paraneoplastic neuropathy, these are syndromes associated with an underlying tumor. If that tumor involves neurological system, it may cause a paraneoplastic neuropathy. These neuropathies are associated with several autoantibodies. And in this section, we will talk about the symptoms, diagnosis, and treatment of these vasculitic and anti-HU paraneoplastic neuropathies. I hope after this overview, you might want to learn more about these immune-mediated neuropathies. So stay with us and keep watching Scardia.com.